everyone. Thank you so much for joining the NeedyMeds special topic webinar, The Financial Impact of Cancer, presented by Triage Cancer. My name is Carla. I'm the Director of User Engagement at NeedyMeds. And before we get started, I'd like to offer some tips so you can make the most out of today's presentation. First of all, if you do have questions, you can feel free to type them into the questions section of your GoToWebinar control panel. Just know that we're going to reserve answering questions until the end. If we don't have a chance to answer your question, we'll follow up with you by email, but of course we will provide the contact information for both NeedyMeds and Triage Cancer at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel, which I hope you subscribe to. And as you saw in the slide in the beginning, you can find some materials we thought you'd be interested in uploaded into that handout section of your GoToWebinar control panel. So let's dive in and get started with what is NeedyMeds. For those of you not familiar with us, NeedyMeds is a national nonprofit founded just over 2 decades ago by a retired family physician, Dr. Richard Sagal, and his friend, Libby Overly, who was a medical social worker. Rich is still the NeedyMeds president. On your screen is all of our formal wording, including our mission statement, our vision statement, and how we achieve that mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and helpline 1-800-503-6897. I always like to put a screenshot of our homepage because really our website is the face of our organization, and it gives me a chance to point out just a few things. For example, if you are looking for healthcare savings, check out the Healthcare Savings tab. If you're interested in educational information such as ordering brochures and drug discount cards, signing up for our webinars, or getting on the list to receive our monthly newsletters, you can do all of that under the Education tab. I mentioned this webinar is being recorded and will be available on the NeedyMeds YouTube channel, and you can find a link to that on the top right-hand side of our homepage with all of the other social media icons. It's the third one from the left. I suggest subscribing because that way you'll never miss when new content is being added. And you can check out and register for all upcoming webinars on the calendar of events on the bottom right of our homepage. So as you saw a couple of slides ago, a big part of our mission is educating people. And of course, we do that by educating them about NeedyMeds, but also by letting them know about other resources available for specific diagnoses, which is why we are so pleased to have a guest with us here today from our partner, Triage Cancer, Monica Fawzy Bryant. And I'll introduce Monica in just a second. First, I want to just tell you what Triage Cancer is. It's a national nonprofit that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. And today, walking us through the financial impact of cancer is Monica Bryant, Esquire, the Chief Operating Officer of Triage Cancer. Monica is a cancer rights attorney, speaker, and author. She, in addition to being the Chief Operating Officer, she is also the co-founder for Triage Cancer. Throughout her career, she has provided hundreds of educational seminars, written articles and blogs, appeared on TV and radio shows, and authored a book on cancer rights laws. So with that history and her educational background and her experience, you can see why we're so thrilled to have her come on and share her expertise with the NeedyMeds audience. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Monica. And as she takes that over, I will remind all of you that if you do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. And Monica should be able to grab the screen, and you guys should be able to see Monica's screen, which is the first slide of a PowerPoint presentation. Fantastic. I'm getting responses from our audience that everybody is seeing that. So I'll go ahead and pass the mic to Monica. Thanks, everybody, and thank you, Monica.
Thank you so much, Carla. I am delighted to be here today to talk a little bit about the work that Triage Cancer does and how to minimize the financial impact of cancer. Now, Carla did give you a quick introduction of us as an organization, and I will say that while we are absolutely a cancer organization, 90% of what we talk about really is applicable to anybody in this country. We just happen to talk about it through the lens of cancer. So I'm going to talk about some resources and some tools and some strategies today that even if you don't have a cancer diagnosis or if you know of others that might benefit from this information, please feel free to share it because, again, just ignoring the word cancer, it's still applicable to so many people. So we are a national nonprofit that provides education on the legal and practical issues, and we do that in several different ways. We provide free resources and educational events, and I'm just going to tell you about a few of them up front because even after our hour together today, you might find out that you have more questions specifically around this financial and health insurance piece, or you might have questions about other cancer-related legal issues. So we definitely want to be a resource to you as appropriate. So our website, triagecancer.org, hosts our materials, which we refer to as quick guides and checklists. They're all downloadable for free, and if we have any healthcare professionals on the line, you can always order bulk copies on our website as well. We also host free educational events. So our conferences this year will be all virtual. They're completely free to attend. And we talk about insurance and finances and employment and estate planning and advocacy. And again, anybody is welcome. We host monthly webinars, again, free to attend. And because, as you'll see through today's presentation, where you live can impact what you have access to, we have state resources and charts of state laws on our website as well. And throughout today's presentation, I'm going to show you links on this slide of where to go for that information. But also in that materials download that Carla mentioned, I created a resource document for you that has all of the links in today's presentation that are clickable so that you don't have to try to retype them in. Now, in addition to our materials and our educational events, we also recognize that people learn in different ways, and sometimes an hour-long webinar is just too much. So we also have animated videos on a variety of topics that are really designed to be an introduction to these topics. And so they're available in English and Spanish, and they all have subtitles. And then finally, sometimes you need more information than what can be included in just a quick guide. And so in those situations, we host a tool called cancerfinances.org, and it has modules about all of the different topics that can impact somebody's finances after a serious medical illness. And the way that this website is unique is that it poses users questions, and then based on the answers to those questions, it will take you to the most targeted information. And then finally, one of our newest resources that was officially launched this morning, so you are hearing literally late-breaking news, is our legal and financial navigation program. So Triage Cancer has always provided one-on-one assistance to individuals who contact us and healthcare professionals. We've done it in a very informal way up until this point. And so this legal and financial navigation program is really just a formalization of what we've been doing for years now. So if you aren't able to find the answer to your question in our resources or at one of our events, you can fill out an online form and someone will contact you to provide you with information depending on your circumstances. So, late breaking news. With that housekeeping and introduction out of the way, let's get into it. Today we're here to talk about the financial impact of cancer. In 2013, researchers out of Duke coined the term financial toxicity, and in their research, they focused on the financial burden of a cancer diagnosis and how significant that burden can be, not just in an acute way during active treatment, but also the long-term impact of that financial burden. And this wasn't just about somebody's bank account, because we also have data that shows how that financial burden causes stress and depression and anxiety, and overall diminishes quality of life. So while this is a relatively new term, it is certainly not a new problem. And one of the reasons that financial toxicity continues to be such a problem is that there's no easy solution. There are multiple contributing factors to financial toxicity, and all or most of the factors need to be addressed effectively to mitigate that financial burden. Now, the primary culprit of financial toxicity is having inadequate health insurance. So that's what we're going to spend the bulk of today talking about, but certainly the potential employment changes that can occur after a cancer diagnosis, and then the life changes that normally impact somebody's finances, like relationship changes or moving or graduating from school. All of those life things continue to happen after a cancer diagnosis, and that financial burden is just compounded by the added expenses around treatment. So this is a visualization of all of the questions that could be asked of someone to help address financial toxicity. And as you can see, it touches several aspects of somebody's life, from insurance to work to practical issues to what does their life look like. And I will admit that this is very hard to see on this screen, but one of those links in the resource guide that I mentioned is to the full-size version of this checklist to avoid financial toxicity. And what is helpful about that full-size version that you can download is on the left-hand side, it has all of these questions. And on the right-hand side, it has all of the resources that we have at Triage Cancer to help you answer or deal with the answer to these questions. Now, ideally, this is something that everybody could look at the moment that they're diagnosed to start gathering information, but we know that that's not always practical. And so really, this could be helpful regardless of where somebody is along the continuum of care. Now, we know that health insurance status is the primary contributing factor to financial toxicity. So theoretically, that's actually pretty easy to solve. The problem is health insurance is so complicated, Americans simply do not understand how it works, how to choose a plan, or how to navigate those plans. And so we have so much data, but I always find this one particularly striking, that only 40% of Americans say that they are confident they can choose the right health insurance plan, and only 4% of Americans could actually define the basic terms being used in health insurance policies. So that just really shows us that health insurance is like learning a new language in this country, but very few people are actually teaching anybody that language. So I'm going to start with some basics to make sure that we are all on the same page. And these basics are going to actually be similar regardless of where you get your health insurance. Now, there are three main places that Americans get their health insurance. The largest number of Americans get their insurance from an employer. The second largest group gets their insurance through a government program, primarily Medicare and Medicaid. And then the smallest number of Americans go directly to a health insurance company to get their insurance. But like I said, regardless of where you fit on this triangle of coverage, the terms I'm about to define will still be applicable. So as we talked about, something as basic, quote unquote, as having an understanding of the terms used in a health insurance policy, it can make a significant impact. So these are some terms that are frequently used but often misunderstood, specifically related to the costs of health insurance. When we talk about a premium, we're talking about the amount you're going to pay monthly just to have health insurance. And you're going to pay this monthly amount whether you go to the doctor or not. Then there are the costs that you incur when you actually use your health insurance. And the first is your deductible. This is the amount that you have to pay before your health insurance company starts picking up their share of the costs. So this is a fixed dollar amount. It's going to vary plan to plan. Someone could have a $100 deductible. Someone could have a $10,000 deductible. It just depends on the plan. And again, you have to pay that amount out of pocket before the health insurance company picks up their share of the costs. That's referred to as the cost share or the co-insurance. And this is a percentage that you pay each time you get care. For example, many plans are an 80-20 plan, which means once you've met your deductible, the plan covers 80% of your healthcare costs and you're responsible for 20%. Now, some plans also have an additional payment called a co-payment. This again is going to be a fixed dollar amount, and it's going to vary plan to plan and service to service. So for example, some plans might have a $25 copayment when you go see your primary care physician, but a $35 copayment to see a specialist, and a $250 copayment to go to the ER. So very specific to your plan. And finally, many plans have what's called an out-of-pocket maximum. And I would argue that this is one of the most valuable things to understand about your health insurance, because the out-of-pocket maximum is, in theory, the most that you're going to pay for your healthcare costs out of pocket per year. And the way that you reach your out-of-pocket maximum is a math problem. So you add up everything you pay out of pocket towards your deductible, everything you pay out of pocket towards any co-payments, and anything you pay out of pocket towards your co-insurance. So it's literally everything you pay out of pocket except those monthly premiums. Now, the devil's in the details for sure. So typically plans will only count payments made towards in-network services towards your out-of-pocket maximums. Also, some employer plans have a slightly different formula. So for example, some employer plans might carve out the deductible from the out-of-pocket maximum. So it is valuable to understand how your plan calculates it. But here's why this out-of-pocket maximum is so valuable. Meet Dan. Dan has a plan with a $2,000 deductible. It's an 80-20 coinsurance, and he has an $8,000 out-of-pocket maximum. Dan ends up in an accident. He hasn't spent anything else towards medical care yet this year, but he ends up with a $102,000 hospital bill. So what does Dan have to pay? Well, the first thing we always have to pay is that annual deductible. So for Dan, that's $2,000, which leaves $100,000 of the bill left. He has that 20% coinsurance. So 20% of $100,000 is $20,000. But does he have to pay that full $20,000? No. And the reason is he has that $8,000 out-of-pocket maximum. So we take everything he's paid out of pocket so far, the $2,000, and we subtract it from the out-of-pocket maximum, and that tells us how much left he has to pay. And then the insurance company picks up the remainder. So I recognize that this is a little bit simplistic, but it helps to explain why understanding the out-of-pocket maximum can be very valuable. Now, if you would like to hear any of that again, the terms in this example, or you think someone else you know might benefit from understanding this, that is included in one of our animated videos called Health Insurance Basics. So I invite you to watch that. Now, many plans in the United States are referred to as managed care plans, which means there is a network of providers that contracts with the insurance company to provide a health insurance plan. But within managed care, there are many different options, and these are three of the most common options, and they have some pretty important differences. So starting on the left with the Health Maintenance Organization, or HMOs. These are managed care plans that are going to have a small network of providers, and they're going to require that everything start with your primary care physician. So if you have a rash, you go to your primary care physician. If he or she can't solve the rash, then you get a referral out to a dermatologist. Typically, HMOs don't have any out-of-network coverage, so in order to get some coverage from your insurance company, you have to stay within this network. So in exchange for less choice and a few more hoops to jump through, you're going to pay less. Moving on to an exclusive provider organization. These are really a hybrid of these other two that I'm going to talk about. So they have a larger network of providers, but no out-of-network coverage. So you have to stay in that list in order to get any coverage. But typically with EPOs, you don't have to start with a primary care physician. You could go straight to that dermatologist, for example. In exchange for more choice and more flexibility, you're going to pay more. And then finally, preferred provider organizations, or PPOs. These are going to have the largest network of providers, often across multiple hospital systems. Many of them have some out-of-network coverage, so the plan won't cover it as high if somebody's out of network, but it will cover some of it. And you don't have to go to a primary care physician. In exchange for more choice and more flexibility and additional coverage, you're going to pay more. Now, this is typically where people say to me, well, which is better? And the answer is, it depends. It depends on what your needs are and what's available to you. So many of the people that I talk to in the cancer community see multiple specialists many times a year across different hospital systems. In that case, a PPO is probably the better option. If I'm talking to a healthy young adult that just sees their primary care for an annual checkup once a year and doesn't travel anywhere, maybe an HMO is the best. So this is just an example of why health insurance is so complicated, because there really isn't one answer. So now that I've talked about some of the basics around how health insurance is structured, I want to talk about some of our options to get health insurance. Many Americans, as I've mentioned, get their insurance through an employer. So that begs the question, what happens if someone has to leave their job or is otherwise going to lose their health insurance coverage through an employer? Cobra is the federal law that allows eligible individuals to keep their employer-sponsored health insurance when they would normally lose it. Now, I said eligible employees because someone has to work for an employer with 20 or more employees to be eligible for this Cobra coverage. The upside to Cobra coverage is it's the exact same plan. So it's actually a misnomer to call it Cobra coverage, because Cobra is just the law that allows you to keep your existing health insurance. So that means the same providers, the same costs, everything you've paid towards a deductible keeps going. The downside is once someone elects Cobra, they're now responsible for 102% of the premiums. So it can feel very expensive to keep Cobra. Now, the length of time you can keep Cobra depends on the qualifying event. If somebody's leaving their job, they would be able to keep Cobra for up to 18 months. If instead the qualifying event is aging out of a parent's policy, for example, they would get to keep Cobra for up to 36 months. Now, I mentioned that Cobra only applies to employers with 20 or more employees. And so what happens to people who work for smaller employers? Then I would suggest going to see if their state has a state Cobra law. Now, the details certainly vary state to state, and we have links on our charts of state laws, but this gives you an idea. So if you work for a smaller employer in Illinois, for example, you would be able to get continuation coverage for up to 12 months. Now, many times people will say to me, Cobra is just not a great option because it's so expensive. And that could be true, but we still think that it should be part of the discussion because there are certainly benefits like the quality of coverage, the network, and if somebody has already met their deductible or their out-of-pocket maximum for the year, it may actually end up being more affordable to keep the quote-unquote expensive Cobra, but know that that's all they're going to pay for the rest of the year. Moving on to the government options. Medicare is the federal health insurance program for individuals who are over the age of 65 or who have been receiving Social Security disability insurance for 2 years or longer. I will tell you, Medicare is incredibly complicated, and one of the reasons is there are multiple parts. So when we talk about Medicare in 2021, this is what it looks like. Part A provides hospital insurance, and for most people who work in this country and pay into the system, it is premium free. Part B is medical insurance, so that's going to cover things like doctors and lab visits. Even if someone has worked and paid into the system, there is a monthly premium and an annual deductible. There is also a 20% coinsurance. When we talk about Part A and Part B together, that is referred to as original Medicare, because it's all that existed when Medicare was first signed into law. Now, Part D provides prescription drug coverage, and these plans are sold by private insurance companies. And so again, the details are going to vary company to company. Now, if someone felt like 3 potential premiums and deductibles and cost shares was just too much and wanted a managed care plan where all of the services are bundled, they could get Part C instead. Part C is also known as Advantage plans, and these are sold by private insurance companies, and they bundle your A and B services together, and many also include prescription drugs. Now, I fully recognize that I just gave you the fastest overview of Medicare possible. Please know we have a myriad of resources on our website related to Medicare, including how to get help paying for Medicare's out-of-pocket costs. So please consider checking that out if you have questions about Medicare. Now, the Patient Protection and Affordable Care Act, otherwise known as the ACA or Obamacare, was signed into law on March 23rd, 2010. And it did some pretty incredible things for individuals with pre-existing conditions, but it did some really important things for all of us as consumers of healthcare. And in large buckets, that's consumer protections and then new options to purchase health insurance. So when I talk about consumer protections, when we look at these collectively, they are designed to make insurance more adequate. So for example, insurance companies have to cover the routine costs of participating in a clinical trial. And most plans have to cover preventative services for free. So we are talking about things like scans and immunizations. And so this is incredibly important because we know, particularly in the cancer community, people would forego getting certain tests and scans because they had high deductibles. And so even though they had health insurance, the high deductibles were still a barrier to these preventative services. So that is no longer an issue for most Americans. And this doesn't just impact people who purchase their own insurance or those with low incomes. This is impactful for most of us as consumers. Another really critical thing that the ACA did was expand access to appealing a denial. Because having access to adequate health insurance is only half the battle. And the reality is that many people with a serious medical condition will face a claim denial at one point or another. And it's critical for people to understand that they don't necessarily have to take no for an answer. There are generally 2 levels of appeals: an internal appeal, which is essentially where you go back to the insurance company and ask them to reconsider. But then there's also an ability to have an external appeal where you go to an independent entity and have them look at the case. Now, I recognize that we are now asking people who are probably in the midst of one of the most traumatic experiences of their life to now go deal with an insurance company and appeal and a paperwork and all of that. However, we know that somewhere between 40 and 60% of all appeals are decided in favor of the patient. So conservatively, that means that when the insurance company says we're not covering that service, 50% of the time, half the time, they're getting it wrong and they should be covering it. So when we talk about financial toxicity and how to deal with the financial impact, making sure that your insurance policy is working the way it's supposed to is critical. I will admit there are lots of hurdles when it comes to appealing, and one of the major hurdles is knowledge. Of the 40 million claims that got denied in 2019, less than 0.2% were appealed. So again, when we think about the financial burden and the financial toxicity, this is a place where people can really be advocates for themselves. And certainly as an organization, we want people to be aware of that. And we also want to support people in the appeals process. And so we have a archived webinar. It's an entire hour just on the appeals process. We have a quick guide. We have an animated video recently released. And then we also have a health insurance appeals tracking form. So it's just a way to keep organized while you're going through this process. Now, perhaps two of the most important consumer rights included in the ACA didn't actually go into effect until 4 years after the law was passed. And what they are limits on what health insurance companies can look at when they're deciding how much they're going to charge someone. And this is referred to as premium rating. So as of January 1st, 2014, insurance companies can only look at, is someone buying an individual plan or a family plan? Certainly family plans will be more expensive. Your geographic location, and that's based on zip code. Your age. So yes, the older you get, the more you can be charged, but there are caps on how much more you can be charged. And then in most states, if you use tobacco, you will be charged more. So what is missing from this list, most significantly, is they can't look at pre-existing conditions and health status, and they can't look at gender. So prior to this rule, women were charged more for the exact same policy than men. But then the ACA went one step further and said that insurance companies can no longer deny selling somebody a policy based on a pre-existing condition or exclude covering services related to a pre-existing condition. And this, I recognize, is now a little bit old hat. We've had it for over 6 years, but for somebody who's been doing this work long before the ACA came into effect, I can tell you, I never thought that this was going to be a reality. And I spent so much of my professional career trying to find people insurance options once they had a cancer diagnosis. There have been many, many challenges to the law in general, and many elected officials have said that they don't like the ACA, they want to repeal the ACA, but they like those pre-existing condition protections. But when pressed, what we learned is they were just talking about number 2. They were not talking about keeping number 1 here. And the challenge with that is, if an insurance company can charge me whatever they want after I have a cancer diagnosis, it isn't really access to say that they can't deny me, because they can just price me out of the market. So in order to stay truly protective, these two provisions have to stay coupled together. Now, as I mentioned, there have been lots of threats to the ACA, which I'll talk about a little bit more at the end of the day, or the hour rather. Now, another thing that the ACA did was it created a requirement for most US citizens and individuals who are lawfully present to have health insurance. And if they chose not to have health insurance and didn't fall into one of the numerous exceptions, they would have to pay a penalty. This impacted very few people because all of these things counted as coverage. In 2019, Congress dropped the penalty to $0. It created lots of confusion. People thought that Obamacare had been repealed. They thought they didn't have to have health insurance in 2018 or 19. It was just a lot of confusion, especially because states actually reinstated sometimes the penalty. And so I've listed those here for you. So this is also where it's important to know not just what is going on at the federal level, but also to know what is going on at the state level. Now, the ACA also tried to address the inadequacy of options for many different people. And so they started with Medicaid. For those of you who aren't familiar, Medicaid is a federal health insurance program run by the states that is for individuals who have a low income level, a low resource level, which is things like a retirement account or a bank account, and someone who could walk through one of these 4 doors. Now, most often for people in the cancer community, they were walking through that age, blind, and disabled door. But the challenge was this was a very high standard of disability. And for anybody who had any sort of savings, essentially, they were barred from this program. So the ACA created a 5th door into the Medicaid program, and it's just based on income. So for individuals who have an income at or below 138% of the federal poverty level, so in dollar terms, we're talking about $17,774 a year, they would have access to Medicaid. So there's no asset or resource test. They don't have to meet another eligibility requirement. It is just about income. Now, this 5th door was supposed to be available across the country. However, the Supreme Court got their hands on the case and decided essentially to make it voluntary for states to expand their programs or not. And this is where we stand as of right now. We have 39 states who have expanded their program and 12 who have not. All of these footnotes at the bottom show you states that expanded after the initial expansion period. And the 2 states in red, their programs, they voted to expand, but their programs don't start until this summer. Now, when we think about the states on the right-hand side who have not expanded, that represents about 3 to 5 million people who could have had access to healthcare, but don't because their state didn't expand. Now, another thing that the ACA did was it tried to address the confusion factor around shopping for health insurance. And it did that by creating state health insurance marketplaces. When the law was originally passed, these were called exchanges. Turns out no one knows what an exchange is. So they dubbed them the marketplaces. It didn't really help with confusion. The best way for me to talk about marketplaces is that they are a health insurance shopping mall, or they're Amazon for health insurance. What you are buying when you buy through the marketplace are plans sold by individual insurance companies. So they fit in the top of our triangle of coverage here. There's a huge misconception that these are government plans. They are not. They are sold by private insurance companies. So then some people ask me, well, if they're sold by private insurance companies, why wouldn't I just go to an insurance company? Why would I go through these marketplaces? And the answer is, well, there are benefits to purchasing through the marketplace that you don't necessarily get going straight to an insurance company. The first is there's some quality control. So plans sold in the marketplace have to meet minimum essential standards. There is also a cap on that out-of-pocket maximum. And for this year, that cap is $8,550 for an individual. Now, I am not suggesting that $8,500 isn't a lot of money. Of course it is. But when you think about my Dan example and the potential for a $102,000 hospital bill, that starts to feel a little bit better. Now, some plans might have a lower out-of-pocket maximum. That's just the ceiling. Now, in addition to the quality control and the cap on out-of-pocket maximums, there may be financial assistance to purchase in the marketplace. And there's 2 types of financial assistance. The first is a premium tax credit. And so that's going to reduce the amount of your monthly premium that you have to pay. The second is a cost-sharing subsidy. And that could reduce things like your deductible or your co-payments. Now, one of the challenges is, again, the confusion around these marketplaces, because we know now about a quarter of the people who are still uninsured in this country could have gotten a plan in the marketplace for free. But when asked, well, why didn't you buy a plan? 67% of the people hadn't looked at coverage because they either didn't think they could afford one, or they didn't need it, or they weren't eligible, or they just didn't know it was an option. And so education has really become a barrier to coverage. Now, plans sold in the marketplace are standardized by their cost share. So if you remember, a cost share is the percentage difference of what you're responsible for paying after your deductible and what your insurance company has to pay. So bronze plans are 60-40 plans. And so these are going to have the lowest monthly premium, but the highest out-of-pocket costs when you go to use the plan. Silver is 70-30, gold is 80-20, and platinum are 90-10. Platinum plans will have the most expensive monthly premium, but the lowest out-of-pocket costs. So what's so valuable about this is that as consumers, we can actually shop for health insurance the way that many of us have become accustomed to shopping for everything else. So I'm on Amazon and I'm looking for a black sweater. I click black and my size, and it weeds out all the things that I'm not interested in. Similarly here. So now when we talk about financial assistance, this is the way that it all looks right now. For people who live in states that have expanded their Medicaid programs, so all those states on the left I showed you, if they have incomes up to 138% of the federal poverty level, they will have access to Medicaid. If someone has an income between 138 and 250% of the federal poverty level and decides to buy one of those silver plans, they'll be eligible for those subsidies, those reductions and things like a deductible. And then for people who are between 138 and 400%, they'll be eligible for a premium tax credit. So that's going to reduce those monthly premiums. So as you can see, some people might actually be able to get both the premium tax credit and a cost sharing subsidy. So when I say that someone could have gotten a bronze plan for free, this is why it's possible. Now, it looks a little different in states that didn't expand their Medicaid program. The cost sharing subsidies are now available to people between 100% and 250%, but the premium tax credits didn't change. And the challenge here is that it's the premium tax credit that helps people buy the plan. The subsidies are only really useful once you have the plan. So the Supreme Court inadvertently created a disparity where they didn't expect one. Now, if someone is interested in enrolling in the marketplaces, they could always start at healthcare.gov, but there are some states that host their own marketplaces, like California, for example. But no matter what, if you start at healthcare.gov, the first question is, what state do you live in? And then the site will take you where you need to go. But I know that a lot of people are wary of the internet or might not have access. And so there's also a toll-free hotline. You can get a paper application to mail or fax in. And then there are also what's called in-person assisters. And these are people and organizations that have been trained on the marketplace to provide one-on-one assistance. They are not paid by any insurance company. They have no vested interest in which plan you choose or don't choose. They are really designed just to help people navigate the marketplaces. If you go to this link and put in your zip code, you'll be able to see the organizations near you. I will tell you that the last administration significantly cut the budget for these organizations, so there are fewer now than there have been in the past. We don't know yet what the existing administration will do about that. But also beware when you go and put in your zip code, it's going to show you both brokers and agents and assisters. Brokers and agents do have a vested interest in which plan you choose. That is how they are paid. And so to just be aware of that before you choose an agent over an assister. Now, unfortunately, or maybe fortunately, picking a health insurance plan is not a one-time job. It is something that we actually need to do every single year. And that is regardless of where you get your insurance coverage. So even if you have employer-sponsored insurance, you should be looking at what your options are. Every single year, and certainly if you're changing jobs. And if you have employer-sponsored benefits, don't just look at the health insurance. Look to see if there are any other benefits that are offered through your employer that might be helpful. And we have 2 checklists on our website that can be useful for you for that. Now, when you enroll depends on what type of coverage we're talking about. So if you, or Medicaid applications are accepted year-round, and so as soon as somebody becomes Medicaid eligible, they can apply. Marketplace typically has an annual open enrollment that in most years would be closed right now, but it has been reopened, which I'll get to in just a minute. Open enrollment for 2022 coverage will be sometime in the fall. And the reason I say that is because the Obama administration had a 12-week open enrollment. The Trump administration cut that down to 6 weeks. We don't know yet what the Biden administration will do. So stay tuned for more information, but expect it to be in the fall. Medicare also has an annual open enrollment, always between October 15th and December 7th. Marketplace plans and Medicare are calendar year plans, which means even if you pick a plan on day 1 of open enrollment, that plan doesn't start until January 1st. Now, employer plans are going to vary, but many have an open enrollment during the fall to coincide with a January 1 start date. So you remember how I said there's some breaking news in that typically Marketplace enrollment is closed right now. The Biden administration and HHS created a special enrollment period that started February 15th and goes through May 15th for people to enroll in new coverage through healthcare.gov. So if you know anyone who does not have health insurance right now, it is to their benefit to look to see what their options are in the marketplace. But it's also an opportunity to change plans if someone, for example, has recently gotten a cancer diagnosis and their plan doesn't cover what they want it to cover. States that run their own marketplaces, many of them have also reopened, and we have the exact dates on our chart of state laws. And I've given you the direct link here. Now, outside of the pandemic and this special enrollment period, there is a normal special enrollment period. So this is anytime somebody has a life-changing event, like a loss of coverage or a change in their family or moving, it triggers a special enrollment period for someone to go purchase a new plan in the marketplace. So what that means now is if someone were to lose their employer-sponsored coverage, they have more options than ever before. The first is picking Cobra or state Cobra and keeping that employer-sponsored plan. The second is picking up a totally new insurance policy through a marketplace special enrollment. The third may be that they're eligible for another group plan, like a spouse's plan at work, or if they're under the age of 26, a parent's plan. And finally, based on circumstances, maybe they're now eligible for Medicaid or Medicare. But the trick with this is that you have to pick a lane and stay in it. You don't get to change lanes until the next open enrollment period. And I realize this is a little confusing because I just told you we're in a special enrollment period, but I wanted to talk about this because after May 15th, this is going to be the situation we're back in again. So if someone is considering looking at their options in the marketplace, I suggest going to healthcare.gov/C-plans. And this is the screen you're going to see, and you start off with putting in your zip code. Now, I want to walk you through how to make choices between various options, and I'm going to use the marketplace as an example. But please know that this example works whether you're trying to compare 2 marketplace plans, when you're trying to compare 2 plans your employer might offer, whether you're trying to decide between, do I take my employer plan or do I get a marketplace plan? Or even if you're trying to decide between 2 Medicare plans, it's the exact same analysis. So here we are with 3 different plan options. A bronze plan with a $173 monthly premium and a $6,000 deductible and a $6,000 out-of-pocket maximum. a silver plan with a $271 monthly premium and a $5,200 out-of-pocket maximum, and an almost $400 a month premium with a $1,150 out-of-pocket maximum. So just by looking at this, can we tell which plan is going to cost us the least, assuming we're going to use lots of healthcare, like during cancer treatment, and hit that out-of-pocket maximum? I certainly cannot. I have to do the math. And the way that you do the math is you take the monthly premium and you multiply it by 12, because that's how much you're going to pay in premiums for the year. And then you add your out-of-pocket maximum. And when you do that for all three plans, you can see that that platinum plan ends up being over $2,000 less expensive at the end of the year. Now, we do this all over the place and the numbers always change and it doesn't always come out this way. But the point here is that many people only look at that monthly premium and they get sticker shock, and they don't realize that having a lower monthly premium could mean that they end up paying way more by the end of the year. But certainly cost is not the only piece that people have to look at. They also need to make sure that their doctors and hospitals are in the plan's network. And I have to tell you, this is not obvious to everybody. Similarly with prescription drug coverage. So if you are taking prescription drugs and anticipate taking them for the year ahead, make sure that those drugs are covered under that plan's formulary. And the marketplace does give us some tools on how to do that. Now, if you'd like to hear any of that again with respect to how to pick a plan and make choices between them, that's included in our How to Pick a Plan health insurance video. And again, that's available in English and Spanish. Now, the last couple of things I want to talk about today are some things just to be aware of. So some health insurance companies outside of the marketplaces are selling what's called short-term plans. And these plans last less than a year, and they have a lower monthly premium as compared with marketplace plans. That being said, individuals who have any sort of medical condition should be very, very wary of these plans. They do not have to comply with the consumer protections included in the Affordable Care Act. They are allowed to deny selling to people. They're allowed to exclude treatments for pre-existing conditions. They have very high out-of-pocket costs when someone goes to actually use it. They're not considered creditable coverage. So when the plan ends, it doesn't trigger one of those special enrollment periods. And the challenge that we are seeing right now is that they were supposed to be eliminated under the Affordable Care Act, but in 2018, the administration actually expanded the availability of these plans. And what we see on a pretty regular basis is people coming to us saying, I wasn't aware when I purchased it that what I was purchasing was one of these short-term plans. I thought I was buying health insurance, and now I have cancer and I can't get access to prescription drugs. So we really just want people to be very, very, very aware of what they are purchasing. And when in doubt, they could certainly start at healthcare.gov and feel confident that they're not going to buy a short-term plan through the marketplace. And then finally, stay tuned. There is a lot just on the horizon that could impact much of what I've just talked about. The Supreme Court has a case in front of them right now. They've already heard oral arguments last fall, and we expect a decision on whether or not the Affordable Care Act is constitutional. So stay tuned on that. The Senate just passed the American Rescue Plan Act, or the latest stimulus package, and the House is debating that this week. There are multiple provisions in that bill that could impact what I've just talked about. We also suspect there are going to be some new HHS regulations coming out as soon as we have a new Secretary of Health and Human Services confirmed. We are waiting on Becerra's confirmation from the Senate. We have heard that a whole host of new insurance companies are joining the marketplaces and are encouraged of how strong they seem right now. So all of this is to say this area in this country is very much in flux. And at Triage Cancer, we have an educational blog, and we routinely update it with the latest happenings and late breaking news. And we try to do it in a way that's really digestible and easy for folks to understand why it matters. And then the other thing is, even after our hour together, you may still find yourself with questions. And I just want to remind you that at Triage Cancer, we have resources on a variety of practical and legal issues. And our website is arranged in many different ways, but in one way it's by topic. And so if you go to our resources by topic, you will see all of these pages, and we have the various resources on those pages for you. And if you aren't able to find an answer to your question, you can certainly always contact us through our navigation program. So these are just some more ways to continue to engage with us as an organization. And with that, I will turn it back over to Carla.
Monica, thank you so much for that thorough and informative presentation. I'm so pleased that our audience got a chance to see why we're so proud of the relationship that we have with Triage Cancer, because not only is it such a difficult topic, but it can be super confusing and people don't know where to begin. And I really like that you started the presentation by saying, you know, this presentation is really applicable to anybody. If you remove just the cancer diagnosis that we're focusing on and talk about really any diagnosis or just being involved when it comes to making a choice about your health insurance plan, it really is applicable to everyone. So thank you so much. And I'm so pleased, like I said, that the other thing is not only our audience was able to see the breadth and scope of the resources you have and the level of expertise, but you got to showcase the website a little bit. I really encourage everybody to check out that Triage Cancer website, because you're going to find not only, as Monica's been pointing out, more additional information, but you're going to see how easy it is to navigate your way through that. It's a really impressive website. And so with that, I'm going to take just a moment to remind everybody that NeedyMeds is also here as a source of support. And while I just do a quick little chat about that, I will remind everybody that if you do have questions, and I see some coming in, don't hesitate to type them into that questions section of your GoToWebinar control panel, and we'll do our best to get to as many of them as we can. So again, in addition to Triage Cancer as a source of support, we do hope that you remember NeedyMeds is here as well to support you, your loved ones, your patients, and your clients. In particular, if anybody is having trouble affording their healthcare costs, because as we all know, even if you go out of your way to choose the perfect insurance plan for you, it may not cover everything you need it to. So remember that NeedyMeds is here to help you with that. And you can find, as I said in the beginning of the presentation, our healthcare savings resources on needymeds.org under that healthcare savings tab. And what you're looking at on your screen are all of those categories you're going to find under that healthcare savings tab. As promised, I want to leave up the contact information for Triage Cancer and NeedyMeds as we get to some of those questions coming in. So Monica, one question coming in, and I bet you get this quite a bit. And tell me I just think that this is a question probably that comes in during every presentation, or people call and ask it, which is this one. I have insurance through my employer, but it doesn't cover all of the providers I want to see. Very common. Can I purchase a new plan?
So yeah, it's definitely a question we get a lot, especially for people who have been in the workforce a while and predate the Affordable Care Act, because as a country, we're sort of conditioned that if we get employer-sponsored insurance, we should hold on to it with dear life, because you might not have another option. But now with the ACA, that's not the case. People can look at what's available to them in the marketplaces. And I actually think it's worth everybody's while to do that, because you might find another plan that is either less expensive, or maybe it's more expensive on a monthly premium, but it covers the providers you want to go see, or a prescription drug that you're taking, and your employer plan doesn't. So I think, like many of us do for everything else, we need to be savvy consumers and look at our various options instead of just assuming that our employer plan is going to be better than anything else we have available. And especially given that open enrollment right now, this is a really good time to do that.
Yeah, thank you to our audience for participating and asking that question. And again, I encourage everybody to ask your questions, because I always say this: if you're thinking it, probably somebody else is. And remember, if we don't get the chance to answer your question, we'll follow up with you, or you can reach out to the organizations at the contact information on your screen. So another question coming in, again, this sounds like it is probably a common one. My insurance company has denied covering some of my tests my doctor ordered. What can I do?
This is unfortunately way too common. As I talked about a little bit earlier, this concept of appeals isn't something that most people are familiar with. But if you are receiving a denial from your health insurance company, and that's whether it's Medicare, Medicaid, through a marketplace, from an employer, you need to avail yourself of the right to appeal. And I definitely recommend talking with your healthcare team about getting their help in the appeal, because you're going to need to gather what's called evidence of medical necessity. And that's really often going to be in the hands of the provider. And so I definitely recommend going back to that provider and saying, listen, my claim got denied. Can you help me with the appeal? Or at least point me in the right direction. And then, just as a reminder, we have all those resources on appealing denials on our website.
Thank you so much. Before I get to another question coming in, which I think is directed towards me and NeedyMeds, I do want to mention we had an audience member when you were, Monica, talking about different state websites. Just want everybody to know that Pennsylvania has a brand new site for the state marketplace at penny.com. That's P as in Pennsylvania, ENNIE.com, penny.com. So I wanted to share that and thank our audience member for sharing that with me. So the question coming in that I think, yes, it is directed towards me. If I have trouble affording meds, where should I start my search on NeedyMeds? So that's a great question. So two places I would say. One is on needymeds.org. In the top left-hand side, you'll see something called a drug search. And that's super easy. It's exactly what it sounds like. You type in the name of the medication, whether it's generic or brand name, into that box, and you will be connected to any healthcare cost savings programs that are available. You can also click on that healthcare savings tab, and all the different categories and ways to save on your meds will pop up, so you can search that way as well. And I do want to stress that if you have difficulty navigating the website, and sometimes it's just easier to talk to a live person, don't hesitate to reach out to our expert call center counselors at that phone number on your screen. They are available weekdays, 9 a.m. to 5 p.m. We are in Massachusetts, so that's East Coast time, and we also have Spanish-speaking counselors. So I do try and keep the question segment brief. So if you asked a question, we didn't answer it again, we'll follow up with you, or you can reach out to Triage Cancer at NeedyMeds at the information indicated on your screen. With that, we're going to go ahead and wrap up today's presentation. Thank you so much to Monica, my friend and colleague, for taking time out of her day to share her expertise with the NeedyMeds audience. And thank you to NeedyMeds friends and users for being here with us today. We do hope you stay in touch and that we see your name pop up in future webinars. Thanks, everybody. Have a wonderful rest of the day. Take care.